Hi, this is Dr. Jan Bellows, veterinary dentist. And boy, am I going to give you some great information on information that you can use in dentistry right away. At least 30, maybe a couple more. A little bit about myself. I went to Auburn, graduated in 1975, became a boarded dentist in 1990, owned two practices, one in a place called Pembroke Pines, Florida, and then moved to Weston, Florida, which is very near Fort Lauderdale. And most of what I do is dentistry, although I enjoy internal medicine cases and some surgery too. We're going to talk about different ways to make your dental practice better, less stress-free, more enjoyable. And I highly recommend that you get a pen and pencil or a piece of paper, or take your own video of a lot of these tips, because these are things that you can use tomorrow. The first one is use your cell phone in the exam room. We used to have cameras in the exam room, and then we'd have to download it either to a disk drive and go up front and print a picture of it. But now with the cell phones that wirelessly communicate with our wireless printer, it makes it so easy to take a picture in the exam room, and also a picture of lesions that we see when the animal is under general anesthesia, and text it to the client. And then the client can see in real time what we're seeing. We even take pictures of the radiographs and then explain it to the client. So I'll show you how this works. Here's a case. Because pictures are worth 1,000 words, if not more. And take them in the exam room. You could enlarge them, share them with the clients, because basically teeth are underneath the lips. And if clients don't see the lesion, they're not as motivated. Right now, when we're doing curbside exams, during COVID, the animal comes inside, we take pictures with our cell phones, then we walk out to the car and show the clients. Or some of the veterinarians that don't even want to communicate with the clients walking out, they email those images to the clients and talk to them from just the images, and they are very powerful. All right, number two, four-handed dentistry. A lot of veterinarians, when they do spays, they go in by themselves and they do the surgery and close it up. And occasionally the technician comes in and checks that the anesthetic levels are fine. But in dentistry, it just makes it so easy if your technician is writing down or going on an electronic medical record, and we'll talk about that in a second, but writing down what you see in the mouth when you're looking at the radiographs. So our workflow is the animal goes under general anesthesia. The technician takes the radiographs, sets them up on a template that we can start when we examine the mouth. The technician hands the veterinarian a periodontal probe, and the veterinarian looks at each tooth and then makes a decision based on there. But the technician writes down the information in the dental chart. Now, with two-handed dentistry, the veterinarian can do all this, but it's not as fast. And even better is six-handed dentistry. Six-handed dentistry, this is Dr. Brooks Nemec's practice. He's doing this, the procedure on the mouth. He's having a technician do the suction, very similar to how a human dental hygienist would do it. And then he has a technician dedicated to the anesthesia. In our practice, when we're doing usually more animals than one are being under anesthesia at a time, because one technician is cleaning the teeth, one veterinarian is doing the actual dental procedure, and one is being placed on the general anesthetic. The technician is going from table to table, doing writing down the vital signs, which include the pulse oximetry, the heart rate, the temperature, the end-tidal CO2. These are all really important. And I ask that the technician actually vocalizes to me what these are, because I find that some technicians just write them on our record and they don't share the information, especially if there's trends. So at least every 5 minutes, I know what's going on with the animal's vital signs, and that way I could be alerted if there's a problem before there's a problem. Number 4, dental charting, and there are all sorts of options. I was very involved with the AHA dental charts. I actually created them, and there's just a wealth of information here. Not only are the teeth nicely visualized, the numbers are there, and on this area, there's the treatment recommendation, and here is the treatment performed. So if you say extract and it's performed, you put a little check mark here. If it's not performed, then no check mark, and then you know what more to do. And there's a bunch of common abbreviations next to it, and we have dog and cat, and these come in pads that you could just use one per patient. Then there's the veterinary information dental charts, and myself and Dr. Steve Holmstrom created these, and there are 6 varieties of these. There's dog and cat, deciduous, and adult, and we have radiographic findings on each one. So there's a lot of options here. And the beautiful part of this is that it's free. As long as you're a member of VIN, you just go on the VIN library. And again, you could write down what you see. You could write it on the record itself. And it's we spent a lot of time making sure this is all correct. And it's a really nice chart to work with. To me, the cat's meow, so to speak, is the cloud-based dental charting. Vetdentalcharts.com. We've used them for the past 2 years. Very impressed with them. Probably the best part of it is that it remembers what was done before on that patient, and it's a subscriber-based system that you pay so much a month, and it keeps track of everything that was done before, and the reports are just exquisite. So this is making the input through an iPad, which can be used, although we don't use it that way in our practice. We have it on the stand, very similar to this. This is Dr. David Clark in Australia, who created these dental charts, dictating, he's doing the exam and dictating to his technician on what he sees and what the next plan is. What's also nice on this program is that each section of the diagnostics is explained in detail on how it's all rated and what it takes to get a calculus index of 3 or 2 or 0. And that way you can do it properly, and there's pictures. This is what the diagnostic chart looks like. And each of these abbreviations means something different. PD looks like periodontal index of 4, mobility 3, and that points to the incisor here. Looks like the left second incisor. And you can see what each of the teeth that are affected by some disease. And then this is what we did with that. So for those incisor teeth that were mobile, we extracted them. So that comes out on the record. And this is all done electronically, and we print these charts for the client so that they really see the value that they got out of it. You can draw, if there's a mass, you can draw on it. This is how you pick different things. This is a very short video on the system.
Flexible system allows you to click on pre-select.
Thank you, David.
The flexible system allows you to click on pre-selected nomenclature, or you can draw your own using a stylus. Radiographs can be added using the feline or canine mounting protocol for a full mouth series, or by using the gallery for individual radiographs. You can even add pictures whilst taking them from your iPad. The system allows you to toggle quickly between previous visits to see how your treatments are progressing or see the advancement of disease. Labels can be customised. In this way, you can add plain English labels or use your own nomenclature. These labels can be set up in any language, and once you've added them, they'll always be there to quickly add to your chart. The system allows you to use the American Veterinary Dental College nomenclature, your own, or simply select the canvas to draw on the chart how you wish. Treatments can be quickly added by choosing the predefined nomenclature, by creating your own, or simply use the Draw On section to quickly note down your treatments. This will complete your chart that has pathology, treatments, radiographs, before and after photos, discharge notes, and an individual customizable tooth report. So please visit us at www.vetdentalcharts.com and try the free trial.
So one of the really nice things about the vet dental charts also is that you can draw lesions on exactly where they are, and they stay in the cloud forever, downloadable. They also produce, or help you produce, really nice, impactful reports for clients. There's before and after extractions. There's all the radiographs taken on the case, and certainly the dental charts of what they found and what was done. And you could upload JPEGs on there also. The way we've incorporated the dental charts in our practice is that every workstation, this is our practice, we have 4 workstations, and every workstation has a double screen. And these are just big TV screens They're not special monitors. And we have one for the radiographs, one for the dental chart, and the technician stays here and they place on the chart what we dictate to them. So here's the veterinarian sits here, the animal's here, and we dictate, and all four areas are represented by double screens. And you can see Umberto here actually, looking at the periodontal disease, and he's actually writing on the dental chart of what he sees, what we dictate the problem, and also that we're going to extract that tooth. All right, next great hack is oral cytology. Can't overemphasize how great oral cytology is. I think it's just a way of being there. I've always believed in general cytology in veterinary school. It was my senior paper. And I've always had a microscope right on my desk so I can see the lesions as close up as possible. Very easy to just take the specimen, air dry it, and then 10 dips up and down in all the three stains, and just wash it off after and examine it. The most important thing that you can, in most cases, evaluate in dentistry is the lesion inflammatory or is it not? And if it's inflammatory, is it pyogranulomatous, eosinophilic, or neutrophilic? If it's other, are there clusters, and there are different types of cell shapes, whether they're malignant or benign. So these algorithm charts are a lot of places, especially on VIN, and you can see better if there's what's going on. So benign lesions cytologically usually have neutrophils in them and fairly large macrophages with little foamy cells. Malignant lesions usually don't have neutrophils around them, and they have very large nuclei, basophilic cytoplasm, and different cell shapes. So you can see how this cell shape is really different from that cell shape. And you can also see nucleoli, which you usually don't see in benign lesions. And this is what they call chromatin stacking there. So here's a lesion. Actually, it's two lesions, one over here and one over here. And you're not sure whether that's benign or malignant. So you place a needle in there. You can't just place the slide on top of that because that doesn't look like it's exfoliating cells. So you place a needle in while they're under anesthesia, and you see the cells are very benign appearing. They're small nuclei. They're, some basophilia, but these are just epithelial cells. And then go ahead and I remove the lesion. I didn't have to take out the tooth. I just went up here and removed it. And the same thing with the lesion back, although I had to take off the tooth there because in order to remove the entire lesion, I had to go above the mucogingival line. And if you have to go above the mucogingival line, you're going to lose the tooth. This cat comes in with a swollen face, and I was convinced it's going to be cancer. And got the cat under general anesthesia, placed the needle in, and it was full of blood. Looked cytologically, and you saw a fair amount of neutrophils. So that was surprising, and macrophages. So this was not typical for malignancy. Took radiographs, and there were areas of dental hard tissue surrounded by lucency. And the history was that some teeth were extracted, and then it started getting swollen elsewhere. And we went in there, opened it up, removed those dental hard tissue that we saw, plus the canine, plus the premolar, and a little area back here, and placed the cat on antibiotics. And within about 2 or 3 weeks, it totally healed. Here's a lesion that very rare, but it's usually in Labradors. there's been a written up study that Dr. Ryder at the University of Pennsylvania was involved with. In order to gain the cytology of this one, we just used a Q-tip and rolled it on a slide. And again, saw lots of neutrophils and kind of benign looking cells that were macrophages. And this came back as it's ossificans. It's a benign lesion that has to do with osteomyelitis. And we went in there and removed the area from here to here to here and block, and the dog did great. All right, so this is another case. This is a dog that has a swelling underneath the eye, was referred in because the veterinarian thought he may have had a carnasial abscess, but if you look at the tooth itself, it's intact. Tooth isn't fractured, so kind of rules out that. Plus there was swelling, hard swelling in this area, and took a radiograph, and this is very abnormal because it's loss of the the pattern of the normal sinus, and placed a needle. I want to aim a needle right in between the furcation of the maxillary fourth premolar. And again, I got blood, but spun down the blood, stained the slides, and cytologically, this is what I saw. So certainly there are different shaped cells, multiple nucleoli that shouldn't be there, and the nucleoli itself are different shapes. So this was definitely a malignancy. Here's another one. This was a squamous cell carcinoma. You can see how large the nuclei are. This is a dog that was referred because it was having problems breathing. No question it was having problems breathing. And it is cytology on that, and you could see the different size nucleoli. You could see these melanin little particles here, and the different types of cells that certainly are not the same, and the multiple nucleoli. So this is a melanoma. And this actually came out really nicely. This was on a stalk. I was able to remove this with a laser, and the dog did well for a while. Here's a case. The dog comes in with a swelling of the muzzle, and you can see this whole side here on the right is all swollen. And the cells just certainly do not look typical of what you would expect. And this came back as a fibrosarcoma. These are fibrocytes. All right, next tip is using a number 11 bit blade versus a number 15 blade. The number 11 blade is pointy, so you can go exactly where you want to go and push, as compared to the number 15 blade, which actually is too big for a lot of the teeth that we are dealing with. You can use a number 11 blade everywhere in the mouth. One of the greatest tips that I have is this periosteotome. I just absolutely love using it. It's a great instrument to use to separate the attached gingiva from the alveolus. And here's, you can see it here. So we make the incision on the front and the back of the mandibular canine and press this right between the periodontal ligament and the attached gingiva and peel it down so you can get access to that, and do it on both sides. Make sure when you buy the periosteotome that you buy a flat one. You don't want to buy a curved one. Buy a flat one. All right, next tip, the thin versus thick faced wing-tipped elevators. Some of your companies, especially the ones that sell the wing-tipped elevators that are less expensive, will have thick-faced. And if you place this in a periodontal ligament space, you're probably going to fracture the tooth. It just is, it's too much to fit in that little area. But if you place a nice thin one with razor edge tips, it's going to be so much easier to luxate that tooth out of there to cut the periodontal ligament and to deliver the tooth out. So look at what you have. And very important that the instruments are sharpened after every single extraction. That is a must. If they're not sharpened after every extraction, then you're going to have dull equipment that just does not work well. And it's very easy to use. You get an Indian stone, place a little oil on it, just like you're sharpening a knife, and you just sharpen the edges. And what's nice about this stone is that it has a flat surface and also has a curved surface. Next tip is use a rongeur versus an extraction forceps. Some veterinarians use what they call a cow horn extraction forceps, which comes from the humans. And human teeth are very, very small from top to bottom. And they just grab in the furcation area and wiggle back and forth, and out comes the tooth. Veterinary teeth are a lot longer because they're there to stay in the jaws so the animal can wrestle with a snake or a rabbit or a squirrel. So I find that the rongeur fits beautifully around the tooth itself as compared to the cow horn, which only points to a couple of areas, and they become more prone to fracture. Very important, get all of your dental extraction equipment in one place at one time. So don't, get the case under anesthesia and then look for the blade and look for the scalpel and look for the wing-tipped elevators and look at another drawer for the extraction forceps and look for the scissors somewhere else. So Steris, which is a cool company, makes a feline pack and a canine pack that we use. And don't just get one of these of each. Get 3 or 4 of them because they're sterilized. And what you can do to help afford it is you have a line item sterile extraction pack and charge whatever you need to charge. And you'll see with all the extractions that you do, that will very, very easily pay for itself, certainly in a short period of time, and you can get as many extraction packs as you feel that you need. Number 13 is use a football diamond burr for alveoplasty. So after you take out a tooth and there's sharp edges, you just don't want to close that because the poor animal will be eating on the sharp edges. So you take a water-cooled football diamond to smooth out that area. You do it with all your extractions. The Vettome is a really, really cool machine. This is like a jackhammer that the blade fits around or into the periodontal ligament, and you go all the way around the tooth. It's put out by IM3, and you're able to take out a tooth virtually without any flap or just a minimal flap. And it is a little technique sensitive, but once you get the technique, it works well. Okay, the next is hemostatic agents. Probably the bane of our existence is bleeding. And they keep on bleeding, and they keep on bleeding. And you're afraid to close it because it's going to bleed more. So what we use in those situations is Hemoblock. We really like Hemoblock. That's a powder that you place on the lesion, and the bleeding, you put pressure on it, and the bleeding stops. You can see here is bleeding. Then we place the powder on the lesion, and then the bleeding stops. Number 16 tip. The Vetquarter makes a portable vital sign that the vet quarter makes a portable vital sign system that goes with the animal into the recovery cage. Unfortunately, a majority of the adverse reactions that happen with anesthesia happen after the anesthetic is turned off. So you want to be able to monitor the temperature, and this patient's temperature is at 87, is a little bit cold, a lot cold. Heart rate is good. SpO2 is a little bit low also, so it certainly needs to be monitored. And by the way, that these can also be remoted into your cell phone. So you can see these images of everything on your cell phone. My office physically is about 10 feet away from the cage. So I see that on my cell phone at the same time the technician sees it. All right, retained deciduous teeth. You could really, if you learn nothing else from these hacks, do open extractions. You know, probably at every veterinary dental meeting, I'm usually asked, what happens when we fracture a tooth root on a retained deciduous tooth, or right now properly what they're being called is persistent primary teeth. And the answer is try not to fracture them. And if you do open extractions, oftentimes you won't fracture them because you're opening up the area and just make an incision right over it. You flap it, take away a little bit of the bone, and then use your wing-tipped elevator to loosen it, and then use your rongeurs to pull it out, and then just suture it back and charge appropriately. You know, this is surgery. There's no reason to chimp on this. This is mandibular retained deciduous teeth or persistent primary. And it's important that you pick the appropriate wing-tipped elevator to go around the root and just hug the root in that direction. You see the direction, it's the direction of the root. And then I was able to deliver the tooth out of the alveolus. Number 18, curve your incision for maxillary canines. Oftentimes when we're giving wet labs, the veterinarians will make an incision here and an incision here, but they don't understand that the canine curves around. So it's real important that you make a curved incision, take away the bone, take away the tooth, and then you see here that it doesn't seem to be enough gingiva to suture without tension. So the trick here, and this is the second grand idea that hopefully you'll walk away from this seminar being able to incorporate. This second part is take your Irish scissors and just remove part of the periosteum. If you don't have Irish scissors, you can remove you can take your blade and place it there. But it's real important that when you get a defect to close, that it's closed without tension. You can see there's even a little bit folding here. There's so little tension. But here, if I was going to close it tightly here, it would have broken down and dehisced. But because I use the Irish scissors and bluntly dissected, we're able to pull it down. Flap design for gingival trauma and recession. So we have this area. Sometimes you have a recessed area. This is a traumatized area, and this is not going to heal well. And unfortunately, once you get past this mucogingival line, that tooth is gone because there's nothing very much holding that support on that tooth. So you make an incision a little bit cranially, definitely caudally. Make an incision above the remaining tooth and below the mucogingival line, then flap that whole area. All right, see that? Then suture it back. So we flap the area, did a little periosteal lengthening here so we could pull this area forward without tension. And you can see how we sutured it, wide sutures. That's what it'll look like right after the procedure. Everything is closed. You don't have that defect that you had before. And this is how it healed a couple months later. So it healed gorgeously. Now, obviously, you have to have a committed client that really wants to save that canine tooth and that will use plaque control, whether it's toothbrushing or what we like a lot is dental wipes daily. Another area of trouble sometimes is the maxillary. If you remove a maxillary first and second molar, you have a defect and you can't figure out how to close it. Well, the best way is to take either a blade or I like the scissors again in this area and go ahead and remove part of the periosteal attachment so you can pull it forward and close it without tension. See, there's no tension here. And that was all done just by placing your iris scissors below and being able to get more of the mucosa to close. Okay, 22. Suture versus wire. We used to use wire to close these symphyseal fractures, but suture works just as well, and it's a lot easier on the patient rather than the wire. And there's even a better way after that, but we'll just show this. So here's your symphyseal separation. It's not a symphyseal fracture because it's a joint, and you place just the needle, a number 16 needle here, place the suture material from one side to the other, and then you go ahead and come around and do it again on the other side. And you tie a knot on the bottom, and then you keep it in there for about 2 or 3 weeks, and it heals beautifully. Another, what we like even we're using better is something called Pro-Temp Garant, which is an acrylic resin that we reduce the separation, make it perfect, and then place this on the outside so there is no wiring, there's no trauma to the gingiva. So that's before, and that's how nice that heals. Now, another great tip, when you have chordal mandible fractures, it's going to be hard to stabilize that. So what we use is buttons. And in the end, the button is going to look like this. So you have 2 on top, 1 on the bottom, but getting there are many YouTube videos on the process. It is not difficult at all, but you have to go with a large amount of a very thick suture and a large blade, and you just fish it from in there out the top into round and around through the buttons to the point that eventually you get to here. And the animal can eat and the fracture can heal. All right, 24. When you're addressed with, or when you have these types of cases where you have alveolar bone expansion, this cat has 2, and you find that it's really difficult to remove the bone. And if you just take out that tooth, there's a big hole. So again, using a periosteotome or a number 2 Molt elevator that's flat and sharpened, and you make a incision distally and rostrally, then take a blade, a number 15 blade, to help separate the periosteum from this big bone mass underneath it. And then go ahead and remove this large area of expansion and the tooth below it. And you can see it still leaves a lot more to go. So then you go in there with your Fisher burr and remove as much of this as possible to the point that you can close the defect up with a suture material. So that's what it looks like on that side, and the other side would also have to be done. Now, when you do that, sometimes the mandibular canines interfere with the lip. You tell the client that this may be an issue that may have to be addressed at a later time, or some clients that don't want anesthesia, again, allow us to either take out the mandibular canines or crown reduce them and restore them. All right, tooth resorption types. It's real important that you know that there are 3 types of tooth resorption. Type 1 is due to periodontal inflammation, and essentially it's to diagnose it, the tooth root is the same opacity as the adjacent teeth roots. Type 2, the tooth root opacity is a lot less than the adjacent roots. Type 3 is you have one of both. You have one of type 2 and one of type 1. The treatment for the type 2 is crown reduction and gingival closure, because what's happening with type 2, it's also called bone replacement resorption. What's happening is that the bone is replacing the root. So why not help it along? You can't just leave it like this because this is very painful and it's inflamed. But what we do is we take an x-ray first and we see that there's a sharp area, which is that area that we have to address. Then make an incision with the number 15 blade in front and behind and flap it. And then take that little tip out and use a very large round burr to remove as much of this as you can, and then close it. And when you close it, take very wide bites on a cutting needle, take a radiograph after, and you can see it's now the tooth root is a lot smaller than it used to be because we removed that part that was exposed to the oral cavity. All right, whoops. Let's get to refractory cases of stomatitis. So stomatitis basically is treated by extracting either all the teeth or all the teeth behind the canines if the canines and incisors are not affected. And if you do that, 60% of the cases will get better without anything else. But what do you do with the cases that are still refractory? And in our practice, we use a laser once a month for 3 months. And we figure that if it works within 3 months, that's great. If it doesn't, then it's not going to work. And we put them on prednisone every other day. So here's the case going in. Here's what it looks like. A couple months later, you still have the inflammation caudally. And this is what it looks like after a laser treatment, where we use the laser, then clean it, then use the laser, then clean it, use the laser 3 times each time, and that's how it healed. So they heal well usually. We also use the therapy laser post-operatively on every case and on every extraction that we do. This is a really great hack where you just take a needle and bend it, and then you can use the needle parts for pulling an interesting area out where the technician can hold that while you work elsewhere. So it's a very inexpensive instrument that works very well. All right, one of my best tips for veterinarians is the 9 o'clock phone call. So any animal that goes under general anesthesia in our practice, the veterinarian calls them at 9 o'clock, never more than 9:30, but it's usually 9 o'clock, and we ask them how the animal's doing. And half of the cases, though, they didn't want to call us, didn't want to bother us, but they feel that there was an issue. It's coughing, it's moaning, it's bleeding, and we make them feel better about that. But they're just so amazed that we care enough to call them at 9 o'clock, and it's really a wonderful practice builder, and it makes you feel good because most of the time the people are going to say, "Oh, dog or cat is doing so much better. I can't believe they ate. And thank you so much. Dental wipes, number 30, really important. Instead of toothbrushing in our practice, we incorporate dental wipes because we find that toothbrushing just doesn't happen routinely. And if something isn't going to happen, there's no grand reason for doing it. So we use dental wipes, and they find that you have to use them daily. If you don't use them daily, then it's just not going to be all that effective. And this is my own pointer. I like the Vetradent wipes because they're really big and they fit around your finger like a handkerchief. We also recommend to our clients the oral cleansing wipes by MaxiGuard. They're a little bit smaller, and animals seem to like the taste and the smell. And there's not really important what's on the wipe, it's the friction. And that's why it has to be used daily. And you should just attend to the outside surfaces of the teeth. You don't have to do the inside surfaces. The tongue takes care of that. So here's a little movie of showing Riley. We keep the wipes on the couch, so when my wife and I are watching TV, we can very easily wipe them. So we wipe. And what Riley gets is a VOHC accepted treat as soon after we do the wipes every day. Good girl. Okay. Good. Oops. All right. For cats, the tip is to use a Q-tip, the same types of Q-tips that you use in to remove earwax, dipped in tuna water. And there's nothing special about tuna water, but the cats seem to like it. And the way that clients can get tuna water is just go in the store, getting some tuna packed in water and squeezing it out and keeping it in the refrigerator, then dipping the wipe into there. And they should place it right at the free gingival margin, right here, all the way around the mouth. And our dedicated cat owners will do this every day, especially when you tell them how important it is. Number 31 or 32, pay attention to the CO2 numbers. If you had to say it, it used to be, way back when, it used to be blood pressure. Pay attention to the blood pressure. But the CO2 numbers will tell you within seconds if you're having a problem with respiration. And you want to keep them somewhere in the 30 to 40 range. If it's too high, then maybe the animal's a little bit too light. If it's that's if the level is too low because they're hyperventilating. If it's too high, then maybe the level's a little bit high because they're hypoventilating. It'll tell you whether the tube is in the wrong tube or if it's compromised anyway. It'll tell you whether the CO2, the soda line hasn't been changed enough. So there's just so much information which you can get from the CO2. Now we're using ventilators in many animals, and that's a really neat way to respire for them. Very important, the types of burrs you use. And most burrs are 19 millimeters. Your surgical burr, the one that we really enjoy using the most, is the 701 surgical, because it has a very big extension and it lets you do what you need to do. And it's a 701 surgical S. It's a cross-cut Fisher burr, a lot taller than the other ones. All right, so what did we learn? Take cell phone images, 4 to 6-handed dentistry, dental charting, vetdentalchart.com, dental cytology, number 11 versus number 15 blade, periosteotome, thin wing-tipped elevators, sharpened with every extraction, rongeurs versus extraction forceps, the Steris feline and canine extraction packs, football diamond burrs, Vetome by IM3, Hemoblock to stop the bleeding, vet quarter after extubation and monitor, deciduous teeth extractions, doing them openly, maxillary canine extractions, going undermine the periosteum so to get greater amount of tissue to close, gingival recession treatment, molar extraction closure, symphyseal separation repair, protomandible fracture repair with buttons, alveolar bone expansion removal, type 2 resorption, and crown reduction with gingival closure, CO2 laser treatment for refractory cases of chordal mucositis or stomatitis, therapy laser post-extraction, flap hooks made of needles, 9 o'clock phone call, wipes versus toothbrushing, pay attention to CO2 levels, and use the 701 Esper. All right, always happy to speak to veterinarians. You can email me at dentalvet@aol.com or call me at the office at 954-465-4200 is my cell phone. 954-349-5800 is the office. Thank you.